Now, good morning, Miss Caskey. Can you hear me?
Good morning, my lord.
Good morning, and good morning, Mr. Smith and Miss McLaren.
Morning.
Good morning, my lord.
Good. Now, we're all ready to start when you're ready, Mr. Caskey.
Thank you, my lord. I'll ask you firstly to introduce yourselves. Can I ask the person on the left to provide the inquiry, my left, to provide the inquiry with their name?
My name's Bryan Smith, and I'm the Chief Executive Officer of Transform Community Development in Dundee.
And the person on my right?
I'm Catherine McLaren, and I'm the Support Services Manager for Transform Community Development in Dundee.
Okay. Can you provide us with information regarding your personal background within and prior to working for the organisation?
Yes, I qualified as an RMN, a registered mental nurse, in 1992, and worked in various roles in Oxford and in London before moving to New Zealand and working in mental health services in New Zealand for several years, returning to the UK in 2000, and since that I've worked for Transform Community Development, formerly Dundee Cyrenians, in various roles, culminating in me becoming the Chief Executive about 2 years ago.
What was your role prior to that?
I was a project manager at one of our registered accommodation roles. Then I was a service manager within the organisation, within the senior management team, running the registered services for the organisation.
And Miss McLaren?
So I started within childcare when I left school. My background isn't as extensive as Bryan's.
Well,
and
you were a lot younger.
Yeah, well, yes. And then I completed a HNC within college, and my placement was within Transform Community Development. I then started as a support worker, and then became senior support worker within our hostel accommodations, and then I became registered manager for our registered services 2 years ago.
You may be aware that yesterday we heard evidence from Sam H, Penumbra and Cyrenians in Edinburgh, and therefore there is a degree of overlap between what it's likely you're going to be telling us and in particular what the Cyrenians were telling us yesterday. Yeah. That makes life a bit easier for all of us, but can you just give us an outline of the organisation, how it works, its charitable status, and so on?
Yeah, we're a charity registered charity with Oscar in Scotland. We have three company with Guarantee. We have three main parts of the organisation. We do housing support services, which combine a housing first service based at Alistair McQueen House in Dundee, which provides a housing first service contracted by Dundee Health and Social Care Partnership in Dundee, which supports around 80 individuals presently. And so that's the main part of the organisation. We also have temporary accommodation unit at Brewery Lane in Dundee, which offers temporary accommodation to 22 individuals within and these are referred by Dundee Housing Department. We also run the Fair Share franchise within Dundee, which is providing food and surplus food from the food industry to charities and other third sector organisations and non-profits within Tayside, Fife and Clackmannanshire. And finally, we have a furniture reuse project, which we collect furniture and use that to furnish people who require furniture, setting up homes, as well as a shop within Dundee. So it's quite an extensive operation. I believe we're the largest independent charity in Dundee, and we have a turnover of about £2 million.
Okay, I'll ask you a little bit more about that. Within the organisation, Miss McLaren, what's your role in terms of where do you fit into that overall structure?
So I'm the registered manager for our registered services with the SSSC, which is our housing services. So that's Brewery Lane, our accommodation, and also the Housing First project.
We heard evidence yesterday about what Housing First is, and if I can summarise that rather than have you re-explain it, you can just correct me if I'm wrong.
Okay.
Previously, the idea of dealing with homelessness was that individuals would have various services provided to them with a view to hoping that they would be able to maintain tenancies ultimately. But Housing First provides people with accommodation first and then bolts on those services. Is that the pattern?
That's broadly correct. I mean, the difference, the only thing is that support is intensive, and the staff to service user ratio is much, it's much less than kind of normal. It's normally could be 1 to 40 for a support worker, but we're 1 to 5, 1 to 7. So it gives the intensity that's required for people to maintain that their tenancies.
I will ask you a bit more about the level of intensity of support provided later. In terms of the food support and the furniture support that you provide, that was described to us yesterday as being a concern for charities such as the Cyrenians, because those issues are effectively upstream of actual homelessness. They are matters which are of concern, because if you can cut those off, it will impact on the levels of homelessness. Is that also the approach taken by your organisation?
Yes, I think those are there to kind of to support the local community, and whether those are homeless people or people who are vulnerable and have other vulnerabilities. But broadly, yes, I would agree with that.
At paragraph 10 in your witness statement, there is reference to the size of the organisation, and you've already provided evidence as to the level of your budget, around £2 million. Tell me about your staffing levels.
Staffing level, we have 30. I think when I said that, we were at 39. There's one current vacancy, but we've got 38 at the moment, one part time, and the majority of those are housing support workers and work within the housing support services within Transform Community Development. We've also got admin and business support staff with that, and with regards to Fair Share and the furniture project, we have core staff, and that's supplemented by volunteers, and the volunteers come from a variety of channels, including individuals who are staying in our hostel accommodation or receiving support and looking for volunteering opportunities to get them back into employability or some sort of meaningful activity kind of going forward.
And can you give us an idea of the number of volunteers that you typically had prior to the pandemic?
We typically had kind of similar to where we are, probably around 20 to 25, kind of. It fluctuated. Sometimes that goes up. It's more about volunteer sessions. We have, say, 30 volunteer sessions, a session being a morning or an afternoon per week. And sometimes there's people who will do the whole week, and other times there'll be people who do an afternoon a week. But typically we're around the 20 to 25 mark of volunteers. And
I also understand that another source of volunteers is prisoners who are on day release.
We've whether they're volunteers is potentially debatable, but yeah, programmes from Castle Huntly generally, which is obviously near Dundee, and the new Bella Centre, which is the women's unit based in Dundee. We've also had placement through youth services such as Helm, which is a youth training programme in Dundee. So there's been a variety of organisations which use the placements that we can offer.
Now, I will ask you about the role of volunteers, or the roles of volunteers, later.
Yep.
But at this stage, I'm just looking for numbers. What happened to the number of volunteers during the pandemic, during lockdowns?
They jumped up significantly. They jumped up significantly for two reasons. There was a degree of people looking for stuff to do and kind of to try and help out within the pandemic. There was also an increase of food, so we required more individuals to be on hand to help distribute the food that was coming through, whether that was bought food in the sense that the Scottish Government and other kind of agencies were providing money to buy food, or whether that was donated food from the food industry.
Again, I'll ask you about that aspect of the organisation in a few moments. You told us about your budget, and you've given us an idea of the scale of the staffing and the volunteering. Where do you get your money?
The four different elements for the organisation. Within the housing support, we are contracted by Dundee Health and Social Care Partnership and get money to provide the support through a contractual arrangement with them. Within Brewery Lane, there's also, we charge rent, and that's generally paid through housing benefit. Within Fair Share, we generate most of that money ourselves through a charging fee. So basically, I mean, there's different models within the Fair Share family, if you want to call it that, and that would be, we basically charge £2.50 for a tray of food, which would typically be about £30 to £35 worth of produce, and that covers kind of storage and delivery, etc. Other organisations do a membership fee for that. We also get some money from the Scottish Government for kind of central roles within that. We also do occasional fundraising for Fair Share as well. Within furniture, furniture's a purely commercial operation. We collect furniture, and we have a contract with Dundee City Council regarding the referral of furniture onto people who require it, but that depends on need. So the other thing we do is we sell the furniture to the general public, and whether that's through our shop or we find interesting items that we might sell on an Etsy website, kind of that. Yeah, maybe the more valuable stuff. The more valuable stuff, yeah.
At paragraph 19, you give us an idea of the sources of your funding.
Yeah.
And that indicates mostly from HSCP. Is that grant funding?
It's a contract. So it's we have to. Every year that's renewed on the basis of us meeting KPIs specified within the contractual arrangement.
And you also receive money by way of housing benefit?
For Brewery Lane, yes.
For Brewery Lane.
Just to clarify, because the people in housing first, it's their own tenancy, so they make their own applications and payments for their housing benefit.
And we know what Housing First is. Can I ask you, Miss McLaren, to have a look at your witness statement, if those behind me are able to jump to that, and can I take you to the section at paragraph 18 where you, as effectively a frontline worker, provide us with a bit more detail. And some of this may have been superseded since you gave the statement, so we'll get that information from you just now. At the beginning of COVID, we were running 3 hostels. So tell me about the 3 hostels.
So we had a direct access hostel, Soapwork Lane, which was 33 rooms, 4 self-contained flats with communal toilets. There was already a plan in place that Soapwork Lane would be decommissioned, and the contract money that we received for Soapwork Lane would be redirected so we could carry out the Housing First project, rather than have the money spent within a hostel accommodation. That was through the Rapid Rehousing Transition Plan for Dundee City Council. So that was already closing, so that we decommissioned that right at the beginning of COVID. Right beginning of lockdown, actually. And then we had the Seagate project, which was 15 self-contained flats. We just decommissioned the Seagate 2 years.
It was, we decommissioned that on the 31st of March 2023.
23. And that was people's own tenancies and people with long and enduring mental health issues, but there was staff in there to support 24/7. And then we also have, and still have, Brewery Lane, which was Bryan has already discussed there. It's 22 self-contained flats.
And the closure of Soapwork Lane and the Seagate project, were those decisions taken independently of COVID?
Yes, I think there was discussions. Soapwork Lane was always closing because the Scottish Government and Dundee City Council were in agreement that hostel accommodation is not appropriate anymore for somebody to be living like that when they're homeless, especially for the periods of time that we were seeing people living within our accommodation. Shared bathrooms, etc., shared kitchen areas. It just wasn't appropriate anymore. It's no way for somebody to be able to graduate on to be able to sustain tenancy. So that was always a plan, to close Soapwork Lane. There was discussions to keep Soapwork Lane open or extend because of the pandemic and because of lockdown. However, we didn't agree that it would be appropriate to keep people who are having to isolate or having to stay within a small bedroom and have shared bathrooms in the middle of a pandemic. So we carried on with the closure of Soapwork Lane.
And you talk about the closure at paragraph 20 in your witness statement. And again, can you just tell us about that and the timing in particular?
Yes, so it was amazing timing to be closing one service and starting a new service. It was right at the start of the first lockdown. So when we closed Soapwork Lane, people were redistributed to other accommodation or into their own network flats. So staff there were predominantly, once the building started becoming quieter and quieter, because we had the same staff number, the same staff team, staff there were predominantly supporting people in moving out and getting them settled within their new accommodations. And then we were then recommissioned to carry out a Housing First based service, which actually was really beneficial because we didn't have a caseload as such. We weren't exactly sure what we should have been doing from our contractors because everything was kind of up in the air because of the pandemic. We were then able to really target those who had kind of been forgotten, I suppose. So it was our beggars within our city. That's where our team really focused our time. So we just went in the town and communicated with our beggars, made sure that they were aware of what was happening, made sure they were getting access to what they needed to get access to, and we also then started supporting chemists because at that time there was no plan in place for some of our participants who maybe are on an opiate substitute treatment for their addiction. There was no plan in place for them to be able to pick up their prescriptions daily. So the chemist very quickly came up with a time that people had to come.
An appointment system.
Yes, an appointment system, which wasn't the best because the people that we support don't have, well, they don't keep appointments. They've got other more important things to be doing. So so that was staff really supported with that. Staff then started taxiing prescriptions.
Explain the taxi.
Yep, so staff to support the chemists and to support our service users from, I suppose, being at the chemists and shouting and all of the arguments that started to happen within the chemists with our service users and members of the general public because there was two separate queues. So it made our service users stand out like a sore thumb. Staff then started to support to actually go to the pharmacy and pick up the prescription and take it to the participant rather than this participant going to the pharmacy.
I think the description given of that in your witness statement by Mr. Smith is that they acted as bouncers at the chemist.
A wee bit staff were, absolutely. Because the pharmacists insisted on having two individual queues. So there was a queue for general public who were maybe there to pick up, I don't know, their own type of prescription, and then there was a completely separate queue for people who were there to pick up methadone. So it caused issues. Members of the public were unhappy if somebody who was picking up methadone was getting in, because why should they get in before them? And our guys felt like they were treated like second-class citizens. So yeah, it wasn't nice.
So how did that remain the situation until the end of the pandemic?
In some pharmacies, yeah.
And in others, were you able to negotiate
So
a single queue?
Yeah, no. There was no negotiating on the single queues. If there was a queue system, it was two separate queues. But other pharmacies changed to the appointment times, which I suppose made it a little bit easier for those who were able to keep the appointments.
Okay. At paragraph 24, Mr. Smith, you provide some information about the background. Is it there? About the background to Housing First, which is quite interesting, about the Helsinki experience. Tell me about this Helsinki experience.
Well, I mean, Finland and Scotland to some extent have been kind of at the forefront of kind of developing kind of much more empathetic housing support services. And whilst Housing First was developed initially in the US, the Finns took it on a slightly different basis and had congregate housing, where kind of there was a group of housing all in the same area where people were kind of in Housing First. But the idea was roughly that kind of you're giving people their own accommodation very, very quickly. What they done in Helsinki is that they looked at all the hostels, etc. they had, and basically rediverted resources. Not all of them. I mean, there's still some, but they rediverted that into Housing First. And with that, I mean, people were able to get access to kind of a house quicker and not be in hostel accommodation. So what it meant that hostel accommodation was only really ever used for real emergency. So if someone's partner kind of threw them out at 2 in the morning, then they could go somewhere, because you wouldn't be getting a new house at that point. But it was very, very short term and kind of a very, very limited number. I think I said 14 or 15. 14 or 15, yeah.
In Helsinki?
In Helsinki, for the whole metropolitan Helsinki at one point, yeah.
And what it is, and in terms of mirroring or learning from the Helsinki experience, how many emergency beds do you have?
Well, as an organisation, we are trying to get rid of beds and and try and move to this Housing First model. There are still some beds in Dundee, and off the top of my head, I'm thinking approximately 40 or 50, 40, 45, 50.
About 70.
Is it 70? Okay.
Including number 22.
Okay, but the plan is kind of is to move them, and that was the plan of the RRTP, which
RRTP.
is the Rapid Rehousing Dundee City Council's Rapid Rehousing Transition Plan, and the plan was always to move to as few hostel beds as possible and having people living, whether that was in a Finnish model, i.e. kind of a block of flats where kind of with support on site, but it was their own tenancy, or whether that was dispersed, more like the American model.
And at the moment, what are Dundee doing? Do they have blocks of flats that people move to? Or is it a more dispersed experience?
It's more a dispersed model. We're in discussion with them about using our Brewery Lane accommodation as that, but there's some legal issues that we need to kind of get over regarding the ownership of the building. But I think there is a will to do that, but it's complicated by the fact who owns the building and the site, etc.
And is there a strategy? Obviously, coming together right at the start of the pandemic with the closure of one of the hostels. Is there a strategy to bring the number of emergency beds down?
Well, where we are at the moment, so the RRTP, or the Rapid Housing Transition Plan, started, and we got, at the start of that, we received funding from Social Bite, the Cora Foundation and the Scottish Government to do the Pathfinder for Housing First. So that, in a sense, was a catalyst to bring Housing First forward in the transition plan, which had initially been in about year 3 or 4, but suddenly using that money was brought forward. With that, the idea at the end of the 5 years there would be very limited beds. Exact numbers were a bit kind of woolly, but the idea was to kind of look at transferring temporary accommodation into accommodation which people could then be their own accommodation. Obviously, the pandemic came around at the end of year 2 of the transition plan. So in year 3, the plan was to shut Jessie Devlin Close or Soapwork Lane, and we did. The pandemic obviously had played havoc with the strategy, and the strategy went out the window a little bit. And in essence, the strategy should have ended, and a new one being in place from the 1st of April this year. Because of the disruption of COVID and the effects it's had, etc., the plan has been given an extra year, and a new plan will be published, as with all local authorities.
In due course?
Not in due course, for the end of it. Well, maybe in due course, but should be by the end of the current financial year. So from the 1st of April 2025, the successor to the RRTP should be in place and should be taking, moving on from the position we ended up at the RRTP. But the direction of travel is very much that Housing First is a remedy for people who have traditionally been in the revolving door of homelessness and have been excluded kind of from mainstream accommodation, and kind of have been kind of the public have maybe been a bit wary of where you're going to put these people who are using drugs and are homeless. Where are you going to put them in the community? The answer is it's about enriching that community further. And we've got statistics and figures that show that Housing First is a better option than mainstream accommodation. And for example, the sustainability levels of Housing First are beyond normal accommodation.
And I think in your statement you provide that information about the increased level of sustainability.
Yes, yeah, and it's a marked increase. We work with individuals who have had 12, 13, 14 homeless presentations over the years, and have now been in accommodation, the same accommodation, for 18 months, 2 years, without any great issues. So it's about kind of giving people responsibility and letting them become active members of their community, rather than kind of this homeless drug using community and the other.
I will come back to the housing services, and I'll ask more questions of you, Ms. McLaren, but I want to move on to the other aspect of the work that you do, and I would draw your attention to paragraph 27 in Mr. Smith's statement. So this is fair share. That's about 20% of the work that you do?
In budgetary terms, yes.
And paragraph 28, you provide information about the geographic area over which your organisation deals with fair share, or does fair share. Tell us about that geographic range.
So the geographic range is the old local regional authority area of Tayside, which is Perth and Kinross, City Dundee, Angus. We also deliver to the whole of Fife and Clackmannanshire. So we've got 5 local authority areas, and although we're kind of in the middle, there is kind of large areas kind of hinterland. The majority of our food goes in kind of the main urban areas there, being Dundee, Perth, and the south of Fife, so Dunfermline, Kirkcaldy, that area. But we do go up to Montrose. We have people up in Pitlochry, Blair Athol, so it does go quite a way.
And you tell us how that's organised, as it were, in staffing terms at paragraph 29. Can you tell us about that?
Yeah. So basically, we have a core group of staff who run the warehouse, and running the warehouse means getting the organising the deliveries of the surplus food in. Supporting the volunteers to sort that surplus food, doing waste, getting sorting out what waste is there, what we can use, setting up orders. So we phone all what they're called community food members, or CFMs. We phone them the day prior to their delivery and say, this is what we've got, what would you like? And so we give people the choice of what we've got, and it's primarily food, but we do get pet food at the moment, and sometimes we take whatever comes in. So sometimes there's stuff that isn't technically food, but it's stuff that people may want. And then it's generally the volunteers generally do the driving, and they go out with two or three volunteers within a van. We've got 12 routes planned throughout the week, and those routes go through the different areas, delivering food to the 154 currently we have community food members right across the region we've talked about.
And so those community food members, they're what you might call local hubs rather than individuals.
They're not individuals. They're local. You could call them local hubs. You can call. It can be a pantry. A food pantry. It can be not so much now food banks. It can be an after-school club. It can be a nursery club. Church groups.
Hubs.
Yeah.
Tell me about the availability of food resources during the pandemic.
Food resources that we were able to deliver went up. There was a real push from the food industry and from government to increase the level of food and to make sure that people were nourished, etc. So we've seen a vast increase in the amount of food that was delivered to us, and because there was an established network through Fair Share, the Scottish Government and other organisations, Dundee City Council, etc., used that network to distribute food to the communities around the city and the wider region.
You've got a lot more food coming in.
Yes. During
the pandemic. How are you able to get it out?
We needed a lot more people, so we put out a call for volunteers, and volunteers came. We also, furniture, because there was no new tenancies coming online, because there was, we couldn't open our shop during the pandemic. We turned the resources we had within furniture over to food as well. So we were able to increase the amount of food we were processing, really.
At paragraph 33, you make in the last sentence a comment about the role of your work in infection control. Can you just read the last sentence?
I would like to think that it minimised infection rates because it meant that people were not having to go out as much and people were able to access food in a timely manner.
And then at paragraph 35, you talk about using the food resource as a hook. Tell us about that.
Yeah, well, there was a lot of people out there struggling, whether it was with loneliness or with kind of inactivity or kind of other issues, whether that was drug addiction, mental health issues, and using the food was, and a lot of people weren't able to or didn't know what services to access. So by using the food, individuals were able to say, well, you're also Fair Share are also Transform Community Development, and we were able to get in and maybe talk to people about other issues that were happening in their life, and it was the food that made that initial contact with people.
Now, I've said that we've heard a lot about housing first and other things. We haven't heard, I don't think, very much about what you talk about at paragraph 36, which is cash first. Tell us about cash first.
Well, the idea of cash first is the idea of not just giving people food, and it's about kind of dignity. So it's about saying, well, the first option if people are requiring food is that there should be some element of a transaction with that. And so because the idea is if you just give people food, it lacks choice, there's kind of less dignity, etc. So the move is that we're moving to a more cash first model. Now what that cash looks like doesn't necessarily mean it's the same price, but it's about kind of saying to people, the food you're getting isn't just somebody's giving you the goodness of their heart or out of charity. It's actually food that you've bought and you can say you've bought, and kind of so that's kind of the model that the Scottish Government are keen to kind of promote. It's not just giving people meals, it's about sustaining that, and getting people back into buying food.
37 and 38, you move on to consider the part of your work relating to furniture. Could you summarise that for us, please?
Well, at the moment, what we do is we collect furniture in the Dundee area, generally furniture that can be sold or put on referral. Without very much work. Maybe a clean kind of small repairs. So the referral system is anybody who requires furniture for moving into new accommodation. A certain amount of referrals can put in referrals. Say they need a bed, this, that, and we make up that pack for them and deliver it to them. The other part is that we kind of just sell it into the general public in a shop, and as I say, we've got more high-end stuff that we can sell online if that comes on. The idea of that is the first bit is about supporting people into their own tenancies and making the house that they are given a home, and the other bit is making more resourceful the organisation so we can kind of develop other services.
And how was that service impacted by the pandemic?
As I said, I mentioned quickly before, basically that ended. We weren't able to go into people's houses to collect furniture. People weren't buying furniture because they couldn't get out to shops. People didn't have any furniture to go away because they couldn't buy new furniture. So basically that ended.
And I understand that one of the ways that you would normally work is to provide furniture to people who are allocated housing from a housing association or the local authority, and that basically was effectively a big starter pack.
Yes,
is that right?
Yeah, and that stopped also because obviously when the pandemic hit, there was no real allocation of housing, so there was nobody moving into houses to require furniture. People were stuck in hostel accommodation, temporary accommodation.
I'll come back to that. We'll get to that. I think the phrase that you use is gummed up.
Yes.
And we'll get to how it became gummed up. You take an overview of the impact of COVID-19 on the organisation, starting at paragraph 39. And you say there, amongst other things, you think that the organisation had a good pandemic?
I think we were very, you mean, if you look at it financially, you mean, and kind of the reach we had a very positive experience. I mean, we've seen more people being supported, more people being helped. We were very, very lucky in the sense that we had very little direct impact from the actual infection. You mean, staff, we had the odd member of staff going off and isolating, etc., for the odd period, but we had nobody who was really ill. We were really concerned at the start of the pandemic that, you mean, we were working with a group of people whose lifestyles may not be the most healthy and may be kind of disproportionately impacted by kind of a virus going around, and we were very, very lucky in that way. But you mean, if you looked at it in the sense of the money that was and the resource and the responsibility that was given to the organisation by the local authority and the Scottish Government, I think we had kind of a very positive pandemic. Not that we'd want another one.
I'll come back to that.
Yeah.
I'll come back to that. At 42, you say nobody furloughed.
Yes.
That was across the whole organisation.
Yeah, as I say, we reallocated, as I mentioned previously, we had reallocated individuals who were working in furniture into fair share. And that's how.
I think you mentioned that there was one person who was furloughed for a week.
Yeah, that was the shop manager, and then kind of she came back and helped with the organisation of the orders, etc., doing some admin work there.
In terms of food, or in terms of...
In terms of food, yeah. Everybody, basically, we just, not quite, but we kind of just shut the door on the furniture for the period. And it slowly came out of hibernation. You mean, as houses became available again, then we were able to kind of take bits and pieces out of the warehouse and kind of furnish people's homes.
At paragraph 43, you talk about the different way in which you were working, and that you were no longer going into people's houses. Tell us about that.
Well, the staff were very inventive on how they were dealing with people. You mean, we still had a housing kind of housing support going on in the community and in the buildings, but you mean, it was much more hybrid. So we're maybe meeting people outside, in gardens, there was cases of through windows that people were meeting people. We were doing drops of food, of electricity cards, SIM cards, top-ups, etc. for phones. You mean, we had one person, we did have to go into their house just because of their situation, but we were looking at different ways to meet people, and people were generally receptive to it because they were appreciative of the support and required that support, because it was about one of the biggest issues we had was people being socially isolated at that point, and it was a way that people could have some sort of social interaction, especially if they couldn't do things like they would normally do, like as Miss McLaren said, go to the chemist, and which could be at times a social hub for people, kind of coming, meeting others at certain times of day, etc. So those things were taken away. Things like the DDARS, which is the Dundee Drugs and Alcohol Recovery Service, their building was shut. So places where people would, our client group would generally kind of congregate and meet, they were all shut. So this was sometimes the only social contact people had. So different things for different people, but there was a whole host of things. We were also able to
kind of skipped over there. These were the only kind of social contacts these people had. Mm-hmm. So during the pandemic, did your staff fill that gap?
For some people, yes, it did. Yes, it did. It was. A lot of the individuals we work with have, little to no family contact. So do you mean that their social group are individuals in a similar position to them? And do you mean it can be, they can be quite fractious, some of those groups, and they kind of fall apart and come back. So do you mean keeping people out of contact with us was causing people kind of real social isolation?
And at 45, you talk about going to chemists and your staff acting as bouncers at the chemist, and I think you've already explained that pretty fully. But just to get the reference in, cross-reference into your statement. At 46, you talk about delivering medication to people who couldn't go.
Yeah, I would say, do you mean, I'm reading slightly ahead about to 47, and that, do you mean, that would be something that would obviously, in a non-pandemic time, might be, oh, you can't be taking methadone, sticking it in your car and taking it up to someone's house. But there was that can-do attitude at the time, and kind of, how do we make sure that people, the vulnerable people in our society, how do we make sure that they're supported, and what can we do to do it? And there was a real attitude, well, not let's throw the rules out the window, but let's see where we can work within the bounds of legality to make sure that people are safe, people are supported, and people are secure.
And I think, Ms McLaren, you describe 2 occasions upon which there was police contact as a result of users of your service coming into contact with the police about drugs. Tell me about that.
So thankfully, we have a really good relationship with our local police officers, and they will give staff a call from time to time to say that they have seen Joe blogs in the city centre, shouldn't be in the city centre, etc. So this happened on a couple of occasions during the pandemic, and normally our guys will be in the city centre to buy substance, to make themselves feel better, I suppose, because they have obviously a physical addiction. But the police thankfully took a soft approach to that during the pandemic, and they would call the key worker to say, Joe Blogs is in the city centre, they know they shouldn't be here, we've just had a word with them, but would you like to come down? And so staff were able to sort of minimise the impact of that very quickly.
You refer to that at paragraph 54 of your statement. And I think there's also reference in Mr. Smith's statement, at paragraph 107. The document, the people who are producing the documents are earning their wages today. And you, Mr. Smith, at paragraph 107 in your statement, talk about great relationship with the police.
We had a great relationship with both you mean the officer on kind of on the street, as well as kind of higher up at inspector level. I can't think that's what our role is, inspector level. So do you mean there was that kind of more strategic view that they weren't looking at this as crime, they were looking at this as kind of how can they support these individuals. Whilst you mean it was really highlighted through COVID, and I would say generally that relationship was there prior to COVID and remains now, but it was really kind of brought into sharp focus during COVID.
And from reading the witness statement from each of you, I make notes as to things to say to you, and one of the things that I've noted down was it a metaphorical clip round the ear?
Yeah, and you mean that also happened. You mean on several occasions. You mean they would come up, especially to Brewery Lane, and say, "Look, we've seen so and so doing this and doing that. Could you just tell them no? Because next time we might have to do something." But there was never any point, as far as I can recall, where anybody was ever arrested or kind of any formal action was taken against any of our service users. Do you mean, because we all, do you mean, right at the start of the pandemic, we didn't think that they might be the most most compliant of our citizens.
And what was your experience?
Much pleasantly shocked. I think. I think
Not just surprised, shocked.
For some people, some people shocked. Yes, some people. Yes, we had occasions where staff had to kind of have words about people going into others' rooms and that. But some individuals who have led very chaotic lifestyles continue to live. Would say you have to isolate for 10 days, and they would isolate for 10 days, not a problem. And we said to them, we're shocked. Mm-hmm. But yeah, it was all very positive, and I think they took it. They kind of bought into the public health narrative. They kind of, yes, this was dangerous. Whether it was out of kind of concern, they've got concern for each other and concern for the staff group. So I think they.
One of the things that we heard yesterday, I think from the Cyrenians, was that people were surprised at the level of buying in by the user groups, but also that people were surprised by users demonstrating abilities that they were not known to have. For example, people going to the shop on their own when previously they required support. Is that something you're able to speak about?
Do you mean we did see? Do you mean I think our service user group have a remarkable degree of skills and abilities that are often kind of masked because of their drug use or ongoing mental health issues. And I think there was situations where people, I think it was more a self-realisation that they maybe didn't need the support that they thought they needed. So yes, we did see people kind of blossoming kind of during the pandemic, in the sense that we did see people doing things that they didn't feel that they were maybe able to do pre-pandemic, and because of circumstances had to do.
There was a concern expressed yesterday by the person who gave us that evidence that might impact on funding, in the sense that if someone's able to go to the shop or the chemist on their own, then they don't need you to help them do that.
I would, whilst I get that, I think that there's, I suppose there's unfortunately there's generally referrals in the system, and I would like to, as an organisation, I'd ideally like to see us shut down, because there's no need for our service. Because everybody is kind of, there's no homelessness, there's no drug issues. So if one person moves on, that's a success for the organisation, that's a success for the person, that's a success for the staff group. And then, but unfortunately, there's someone generally coming up behind. So, and the way doing that, we generally work with. We're doing housing support, so it's generally more transient than maybe some care roles where kind of I could see that being a concern.
At 48 and 49 in your witness statement, Mr. Smith, you provide two other examples of how it might be described that you had a good pandemic. Tell us about that.
Well, as we said, there was a greater number of groups requiring food. Both the local government and the Scottish government were putting money forward to purchase food. So some of the things that you don't always, one thing about Fair Share, you can't predict what's coming in because it's surplus from the food industry, and so it can be 25 litre tins of Bovril, and it can be things that you can't get out. So the government and the local authority bought food, and so at the minute we generally don't buy food, and we didn't buy food prior to the pandemic. So with that, it just increased the amount of food, the physical amount of food that was coming through the warehouse. Now, obviously, there's the same charges, different charges applied, but some of those same charges applied. So therefore, income to the organisation went up to deliver this food. And at times, there was nowhere. We were putting some of the ambient food in clearing areas in the other warehouse we have, which was predominantly furniture, to put ambient food in, so we had enough room to do it.
It wouldn't go off.
So it wouldn't go off. Some local authorities hired warehouses. They hired the warehouse in Perth and Kinross, for example, that we shared with Perth and Kinross Council as another hub that we could deliver food from. So there was just the amount of food that was around was it went up. I can't give exact numbers, but it went up by over 100%.
Okay, I want to move on to paragraph 52 in your statement, Mr. Smith, where you talk about visiting. Yeah. And you talk about during the pandemic, we were only going out to visit and check on people who were known to us as an organisation. So you weren't effectively taking on new clients, although there were exceptions to that. Yeah. Can you tell us about the exceptions?
The exceptions would be that people would, I suppose, the way Housing First works is that Housing First predominantly is about getting people a new house. But obviously there wasn't tenancies being offered during the pandemic. So we were working with people, we were occasionally working with people who were in housing crisis but currently within a tenancy. So those would be discussed with Dundee City Council Housing Department, that people were potentially at risk of. I know people weren't evicted, but their behaviour was such it was causing alarm to neighbours, etc. So it was about people who were in some sort of crisis during that period, but in their own flat. So that part of the Housing First, i.e. getting people a tenancy, wasn't there, but the ongoing support was there.
Okay, that was useful, but the reason I asked you about visits was to ask, did they continue during the pandemic? Were you still knocking on people's doors?
Yes.
And I see at paragraph 52, you talk about the connection with the social work department. Tell us about that in the context of knocking on doors.
Well, we were one of the, especially at the very start, we were one of the few services who were still going out to see people, and a lot of things were done over phone calls, done over Teams, Skype, whatever. So we were one of the few people going out. So sometimes social work were saying, could you have a look in on this person? Are they there? Are they? So there was some joint work there.
Would that normally be something that social work would do themselves?
Yes.
Outside the pandemic.
Yes. We would look at, in a sense, we would support our clients, and social work would support their clients. But during the pandemic, we done some. As I said, their eyes and ears. We weren't doing full assessments. But we're just going in and say, yeah, we've seen them. They're fine. They're managing. They need this. They need that. And but the social work weren't going out at the start of the pandemic.
One of the things that we heard yesterday from, I think, two of the people who provided evidence was that the statutory authorities pulled back and left you to those organisations to fill that gap. Was that your experience in Dundee?
Yeah, that was certainly our experience. And there was a lot of, well, you could do that, you can do that, you can do that. And whilst that can-do attitude was great, sometimes we were the ones Johnny on the spot, so to speak.
Ms McLaren, can I ask you to look at 27 in your witness statement? And I think you say something about a similar area there. Could you say some more about what's in 27, please?
Yes, so that's just discussing about the wait times for if someone presents to DDAR's, Dundee's Drug and Alcohol Recovery Service, for OST, so the opioid substitute treatment, you would...
Methadone.
Yes, so methadone or Subutex or something along those lines. You would, pre-pandemic, you would be given an appointment. You would then be given things called, it's called a drug diary, and where you would have to list everything that all substances that you'd used in that day and at what times, and your thoughts and feelings before and after use. And there would be pages of this, so you would have to do this for sometimes up to 3 months, where you would at times see another worker from DDARS during this period of time. However, during the pandemic, one of the real benefits, that completely stopped because there was no staff within DDARS. The building was closed. Nobody was seeing anyone. So the really good thing was staff were able to call and say, this person, Joe Bloggs, needs a prescription. This is how they're presenting. They're in withdrawals. This is how much they're using per day, and very quickly Joe Bloggs was given a prescription at a chemist, sometimes within 24 hours.
And I imagine from what we've heard that for people with particularly drug problems, keeping a diary for 3 months is not going to happen.
No, and it didn't. It never happened. It was a massive barrier for people. Also, the people we work with when...
Sorry, you said it never happened?
I've never known anybody to complete the 3 months diaries. Never.
And was that the mechanism by which people were able to access methadone?
Yes, so there was always a step back. It was always a step back, and it was always, and it was a fight. It was a fight to get people to be able to gain prescription pre-pandemic.
But during the pandemic, that changed?
Absolutely, turned completely on its head. And thankfully, we are starting to creep back up to a small waiting time now. However, that has stayed. There is no drug diaries been re-established within Dundee, within DDARS.
Paragraph 40, you talk about barriers to a different source of support. Can you tell us about that?
GPs. GPs, obviously they closed their doors, and you could only call. A lot of the people we work with don't have a phone. If they do have a phone, it's what we would call a burner phone, so there's no access to Wi-Fi, there's no internet, I think they do have a camera, but I don't think they send camera photos or anything like that. Certainly no WhatsApp abilities. The GPs, so you had to call, and if the person had an ailment, so a lot of our guys, they will have sores, etc., or abscesses, ulcers, you would have to send a picture. Well, the people we work with predominantly just would not be able to do that.
Because they don't have...
Because they don't have the facilities.
Camera phones.
They don't have the facilities to be able to do so. So staff would try to call the GP and ask the GP for a callback time so that the staff member could be with the person at the time. That was, with some GPs, that was a massive barrier. They wouldn't even take the call from staff. The staff member had to be with the person, which meant the staff member would have to expose themselves by leaving their homes to be with the person just to make the call at 8 o'clock in the morning, which sometimes you can't get people up at 8 o'clock in the morning, and then the staff member would have to go away, wait for the GP to call back, and get back to the person's house very, very quickly because there was no times given. And then that was staff would have to sometimes take the pictures, which obviously wasn't great for the people's dignity or for staff's. But that's what we've done. That's what staff done.
We've heard evidence already from other sources about connecting Scotland. And you, Mr. Smith, refer to that at paragraph 55 in your witness statement.
So connecting Scotland, just it was prior to both prior and during the pandemic, we had Connecting Scotland Fund, and that gave service users the opportunity to get what do you call them, Chromebook, or at that point it was an actual iPad. It subsequently, when we said they don't need to be iPads, can be anything. So we were able to give out those, but I think as important as the laptops or the whatever were the data packages, the dongles that came with them, because they were the one. It was that gave people the access to the internet and be able to do things, and whether that was about doing things via Skype or Zoom or what have you, or whether that was about kind of watching football on YouTube, it just gave people a connection into that wider digital world, whereas kind of traditionally this group of individuals have been excluded from. We were somewhat sceptical prior to the handing out of these, that they would find them all in cash converters the next day. It was, once people valued them, it was amazing. The vast majority were kept and used and valued, and people looked at, well, how can we continue that support coming on? So that came in several tranches.
Ms McLaren, you talk about the same area at paragraphs 29 and 30 of your witness statement. So if you give the magicians behind me a second. There we are. Can you talk about what's in 29 and 30?
Yeah, so we, as Bryan has already stated, we were able to get the data packs, and the mobile phones in particular were very, very handy, as I'd said before, especially with things like the GP and for benefits, etc. But not only for the news. I mean, our people that we support were so disconnected. The only time that they were getting any advice was from staff. Because
when you say advice, do you mean news? Yeah,
news. So the Scottish Government advice, the public health advice for during the pandemic, it was all from staff, because they weren't watching the news. Some of them didn't have televisions, they didn't have access, like I say, to Wi-Fi or any data. Some didn't have a phone at all. So being able to get them the devices and the ability to be able to listen to the news, make contact with family because they couldn't get out to see family. Those of the people that we support who are still in touch with family, just seen a massive difference. It was such a benefit to the people that we supported.
And you talk about that again at paragraphs 42 and 43 of your witness statement. Tell us about what's there.
Yeah, so this was more about the sort of informal use of the data in the phones, but being able to FaceTime family and WhatsApp to be able to keep in touch so that it wasn't costing any money for their minutes or their messages, and to keep them in and to have something to do within their accommodation, whether that was within our Brewery Lane accommodation or within their own tenancies. Because I couldn't imagine being in the middle of a pandemic and staring at four walls for 24/7. So having something to do was amazing. And then the guy who was able to access recovery meetings, but within America, so he was really struggling with his recovery, but through the night. So being able to access those meetings out with the UK was invaluable to him. And that was because of the Connect in Scotland and being able to get the phone and the data pack.
And has any of that continued post-pandemic?
So we did post-pandemic. We had another tranche of data packs and phones. The funding has unfortunately stopped. However, they are bidding to get some more funding to be able to do that again. And I think this time they're going to call it Connecting 200, I believe. So yeah, fingers crossed for that, because that would be really good for the people that we support.
And did it make a significant difference?
Oh, absolutely.
During the pandemic last time?
Yeah, absolutely, yeah. And like what Bryan was saying, our participants have really seen the value in that, and most of them now who have a tablet or some other form of device like laptop, who are in their own tenancies, they now pay for their own Wi-Fi so they can still use those devices, it surprises me still.
It surprises you that they've not turned up cash converters.
Yeah, and I think, I was trying to recollect whilst Bryan was talking, but I'm sure from the start, there's only 2 people that I know of that no longer have their device. And we had...
And one was genuinely lost.
Yes.
One was genuinely, it fell somewhere and lost.
And I think we had over 100 devices from Connect in Scotland and Connect 500, I think was the other one.
At 50, I'm going back to you, Mr. Smith, 56 and 57. You talked there about the burner phones.
Yeah, we were able, we found, I mean, it's not a big secret, but I mean, we found a supplier, i.e. Tesco's, who were able to supply, I mean, a phone and a SIM card with £10 credit for £12 during the pandemic. So we were buying quite a few of them and had kind of drawers full of those, and we were giving those to people who didn't have any way of contacting the service. So at least, if nothing else, we could phone and keep in contact with them. And we got the money from that just through our own resources. Also, if people had phones that they were kind of getting rid of, upgrading, etc., we would take them and kind of give them to people. But yeah, we found Tesco's were able to kind of we would supply phones at that kind of at that price, and we'd give them the £10 phone with the £10 credit, and it made a huge difference, especially because mostly we were phoning them, so it really wasn't impacting on their cost, but it did really impact on the level of support we could give. And even kind of very simple things like they would phone and say, "I'm not feeling well today, don't come up." Whereas kind of so we could check that they were going up to see someone and they would be there, or we could check that they were that they were well, or there was all sorts of just that kind of very kind of low level support, but just to make sure people were safe.
As you know, we're going to have a break at 11 o'clock. We're not quite there yet. I've got one more thing to ask you about, and that's paragraph 59 in your witness statement. Now, this is going back to fair share food.
Yeah.
And you talk there about the increase in the number of volunteers, meaning that people were able to go out and deliver food. But you also talk about taxis.
Yeah.
Tell me about the taxi organisations.
Well, again, there was a company in Dundee that was, I think, Zippy Delivery, who were a kind of a taxi stroke, like food delivery kind of company, and during the pandemic, themselves and kind of traditional taxi companies as well, if there's food to go out and you don't have the resource to do it, we will help. And that was all funneled through Dundee City Council. And with us being on the Gold response team or group, I can't remember what the exact name was, they were able to coordinate people coming in and offering help, whether that be local businesses or individuals, and saying, well, I'd like to do something during the pandemic. So they would put volunteers and organisations our way, which could help in the delivery of that food. So some of that being taxis. So if we had vans going out, but there were still lots of other food to go out, there was organisations. One was, there was taxi companies. There was also Alexander Community Development, which was basically a painter and decorators who would use their vans to kind of deliver food in kind of suitable, hygienic casing in that, and take that food out to the people who needed it. So it was just about kind of using the resources, and the Gold Group kind of helped kind of bring that all together.
My lord, that's an appropriate point to have a break.
Very good, thank you. I noticed from the timetable you might not want the normal 15 minutes, you want longer, is that right? Or
No,
just reading
no, my lord, 15 minutes is ample.
15 minutes is fine. So we'll say 11:15 then.
I don't think we'll be going till 1 o'clock.
Okay, super, thank you. Right, can you hear me, Mr. Caskey?
I can indeed, my lord. Although something's just appeared on the screen. Okay. We're ready to begin, my lord.
Yeah, can you hear me?
Yes.
Good. Very good. Proceed, Mr. Caskey.
Well, thank you. I was just about to move on to paragraph 60 of Mr. Smith's witness statement. And I'll wait for that. And that talks about, in terms of the allocation, the accommodation you're able to source for people, who are the landlords generally?
The landlords are generally Dundee City Council or RSLs, which are housing associations. Primarily, that would be Hillcrest Housing or the home group. But there is potential. There are other smaller housing associations within Dundee. There has, on occasions, been private rented landlords.
I'll ask you about that in a second.
But not as popular.
You tell me that I suspect amongst your users there's a distinction between Dundee City Council accommodation and housing association accommodation. And you talk about that at paragraph 61.
Yeah, you mean Dundee City Council are housing tends to be in the outskirts of Dundee. You mean the schemes kind of on the periphery, the other side of the Kingsway in Dundee, not exclusively, but kind of generally. Whereas, especially in the last couple of years, housing associations are building properties in kind of gap sites and smaller, and maybe in areas where people would want them more near the town centre.
And at 62, you referred, just as you did to a moment ago, to private rented accommodation and indicate that that's not something that's generally used.
We don't exclude it, but you mean it can be more difficult with regards to things like repairs and the understanding of private landlords. You mean if there is a damage or that, maybe housing associations and the local authority are slightly more understanding than private landlords. The only time that we've had people using private landlords is generally if there's several areas in Dundee where there's very, very little social housing, and if people's support mechanisms or kind of preferences are there, then you mean we would look at private landlords, but currently we have no one in private private accommodation.
And I think you say later in your statement that simply because of the size of Dundee, getting people into their home area, if I can put it that way, isn't such a major issue.
That's right. Dundee is geographically quite hemmed in, so do you mean and public transport, whilst not kind of 5-star, is certainly kind of relatively effective. So do you mean it's not such a big deal as than say a rural area where you can put somebody in a different town? Do you mean so kind of moving people in areas are not necessarily mad keen on isn't such a big deal as it can be in other in other local authority areas.
Because people can get back relatively easily to the connections that they had in their, quotes, home area. Yes.
And the other thing is, I mean, there is a somewhat a difference. I mean, the east part of the town, generally the houses are slightly bigger, so a lot of the one-bedroom flats, which our participants are looking for, tend to be in the west end of the town.
Okay. You say that during the pandemic there was a particular problem with your 22-bed unit. I take it that's Brewery.
Yes.
Brewery Lane.
Yeah, the particular problem there was as it was almost frozen in time. I mean, the pandemic lockdown came. There was no way for people then to move on to other accommodation because
There was no allocation.
there was no
as you said
allocation.
earlier.
Yeah, so there was no allocation. So people who were in Brewery Lane on the day of the lockdown, almost that was them. That was them there at that point, and that had that basically backed up right through the system. So there was no temporary accommodation. I mean, there was a lack of temporary accommodation for people to move into, and so I mean, I think the
And
word.
typically pre-pandemic, what's the turnover at Brewery Lane?
I would say, on average, about five to six people per month would move in and out of Brewery Lane. Generally,
So what you have is you have 22 beds.
Yep.
And you have 5 to 6 people a month moving into their own accommodation, but their own accommodation is no longer available to move to. And therefore they're fixed in that accommodation.
That's exactly it. Yeah.
And I think you describe that as the system being gummed up.
That's exactly what happened. So, do you mean any time anyone presented as homeless with Dundee City Council, their normal reserve of temporary accommodation was full? Because if I remember correctly, we were full or all. I mean, I'm talking Dundee wide, full or almost full at the time of the lockdown, and so do you mean there was very little wiggle room? Do you mean there were some people who kind of got in under the wire, and there was a couple of kind of just before the lockdown and created a little bit of capacity, but that was very quickly gobbled up. So in that sense, only we had to they had to look at different ways of giving people temporary accommodation under the Act, which they're kind of compelled to do, and that was generally hotels and bed and breakfasts.
I'll ask about hotels in a moment, but you provide some interesting information at 66 in relation to rough sleepers, and you tend to indicate that rough sleeping isn't a problem in Dundee.
It generally isn't a problem in Dundee. I'm not saying that there isn't some rough sleeping in Dundee, but it's I mean our numbers, our anecdotal evidence shows that people are rough sleeping out of ignorance of the services that are available, and once people are aware what services are available, then people will access generally services. So people are doing rough sleeping because, for example, they've been thrown out of their accommodation an hour or arrive in the city an hour, which kind of they don't know what to do. So it's generally very short term. It's intermittent. I think there's a disconnect, and it's proving a negative, so it can be very difficult to prove. But you do get people saying on their their homelessness application that they slept rough the night before. We can find no evidence of that, but they feel that it's beneficial to them to their application by saying I'm sleeping rough. But under investigation, it's maybe not as clear cut as that.
Okay, Ms McLaren, at paragraphs 36 and 37 of your witness statement, you talk about the extent to which lockdown impacted upon the ability to provide talking services, both in Drury Lane and also for people who had moved on from there. Can you tell us a bit more about that?
Yeah, so as we've already touched on, one of the biggest impacts for the people that we support is the self-isolation. That was already a need before pandemic. During the pandemic, that was obviously heightened massively. And when we as a service and following guidance, we're saying you cannot enter people's homes, you can't spend the same support sessions with people. It has to be very quick sessions just to see how they are, whether that was through a window in their closely or I'd seen them in the garden. We've seen that people's mental health drastically dropped. They were very depressed, very lonely. just couldn't see a way out, had nobody to talk to, and that's why the phones again were a massive thing, because they were able to at least communicate with family or staff. But we then took advice from our staff who were saying that's not enough. What you're telling us that we are providing for the people that we're supporting is not enough.
Not enough for them.
For our people,
for
the
clients.
people that we support, absolutely. So we then looked at our risk assessments as a whole, as a service, and says, well, what can we provide then safely for our staff and for our participants and for the wider public, but be able to minimise the self-isolation as much as possible. So that it was an agreement that if somebody was extremely struggling and seen as in crisis for the self-isolation, staff, as long as they were full PPE, could spend longer with that person. And that was taking advice from our staff. Our staff reported that to us.
Going back to you, Mr. Smith, in your statement at 68, you mentioned in passing earlier the use of hotels. Can you tell us a bit about that?
Yeah, I mean, obviously there was a real drop-off of travel and tourism during the pandemic, and therefore, but with people kind of still presenting as homeless during the pandemic, it was, there was almost, I suppose, a quid pro quo, in the sense that, the hotels were looking at ways that they could continue to operate. Dundee City Council were looking for accommodation, and the two came together. So, to stop that kind of gummed upness, people were able to go into kind of hotel accommodation. There were several hotels in Dundee who really kind of took it on. Some higher end hotels were actually some of the better hotels, and their staff were amazing and kind of amazingly supportive of our staff, of our client group. But it was just about kind of making sure that nobody was sleeping rough, that people's rights, i.e. kind of the 28-day assessment of being homeless, was still kind of being seen to, and it was giving people accommodation. So the hotels were kind of scattered around Dundee. They weren't necessarily in areas where traditionally homeless people would congregate, but despite that, the local community and the staff within the hotel. There was one hotel in particular away out in kind of Broughty Montefiore area, which is kind of a considerable distance from the centre of Dundee, and kind of services like chemists and what have you were used, and our housing support team supported the staff as well as the service users within the hotel.
Because there isn't a lot of methadone use in Broughty Ferry.
I would probably think that's the case, yeah.
Okay. You then move on to talk about your own, the impact on your own staff, and you talk about the difficulty of staff going online, and at 71 you talk about the absence of a debrief.
Yeah. I'm not saying debriefs didn't happen, but there was that informal debrief where, as the day goes on, people come in and out of the office and say, well, that was terrible, or that was great, and kind of getting feedback. So, it could be very, very difficult, and people, in pinning staff down and kind of saying, how are things? Because a lot of that informal kind of support that is there in kind of a normal office situation kind of had disappeared. So to debrief or to kind of feedback to staff, there had to be, you'll be at one side of the phone, I'll be on the other side, we can speak about it. That kind of standing around having a cup of coffee or whatever had gone, and that was difficult, and staff were fantastic, but they're also quite stoic, and I'll be fine, and we'll go on to the next thing, and kind of assessing how they really were could be very difficult.
At the end of paragraph 73, the final line, you talk about, amongst your staff, an increased level of wariness among staff regarding transmission of COVID. How did that manifest itself?
you mean just because, you mean the numbers were going up and we were doing more work, in a sense. Now, whether that was more work, i.e., kind of people within the warehouse, kind of getting food out, meeting, kind of interacting with drivers, etc. Whether that was about kind of staff going out and kind of seeing other individuals, whether that was about staff then doing all this and going home. And so there was, and I think especially near the start, there was a lot of unknowns, and I think people were worried. Well, is what I'm doing safe? Are the risks we are taking, are they risks that are acceptable, or should we be doing more? Should we be doing less? Like all organisations, we had some people who felt it was some sort of hoax, and they didn't need any protection, and you had some people who were almost terrified of the consequences of.
You also talk about, in particular, in the food end of the service, about increasing levels of stress because of the increased workload.
Yeah.
Did you get additional staff? I don't mean volunteers. You've said you got extra volunteers. Did you get additional staff or funding for additional staff?
No, we didn't get any. Additional staff as such? There was additional staff by the redeployment of staff from furniture into, and there was often we asked for others within the organisation to help out. So I went down a couple of times and helped. I know Catherine did. I know the old chief executive at that point went in and helped. So we all mucked in a bit to do what was required, because although the housing support workload remained, there was elements of their work that they weren't able to do because of the pandemic. So there was maybe some slack at some times where we could relieve some staff members to support the wider operations of the organisation.
And if I can summarise paragraph 77, you talk about staff morale going up and down, varying over time. But you also say, I want to credit the staff because they did not let the impact on their morale impact on their jobs, essentially.
Yes, I would say. The staff were amazing throughout. They supported the service users, the organisation, and each other in a way that I'll never be able to thank them enough for.
You're not the first chief executive we've heard that from.
Thank you.
On paragraph 79, you talk about absences, staff absences.
Yep.
That didn't increase.
It didn't increase because of live COVID infections, as far as I remember. There was an increase due to self-isolation and the rules, and people's partners or children or what have you having COVID and therefore having to self-isolate. But we didn't see a marked increase that caused problems with staffing. It was above normal levels, but our normal levels are relatively low. So it was above normal levels, but still within a manageable level. And we were able to work around it.
At 47 and 48 of your statement, Ms. McLaren, you talk about some confusion among staff. Can you tell us about that from your position as not chief executive, if I can put it that way?
Yes, so I'd like to think we've got a very good relationship with our staff where they are able to say how they feel and what they're thinking at the time, sometimes very loudly. And during the pandemic, this was a massive concern for staff. They were very confused around the guidance. It probably didn't help that we were, myself and Mr. Smith, who were giving the guidance, were also confused by the guidance. So we were trying to make grab-it sheets for our staff and for our participants, which broke down the guidance as simply as possible. However, just one example I've given is about the mask. The mask had to be worn when you were up and walking, but you were fine to sit at your desk with no mask on, with somebody sitting at their desk with no mask on. So staff were just very confused. It also didn't help when the guidance, there was no clear guidance for hostel accommodation. So we were following guidance from Public Health for daycare services, because we are not a care home. We do not do any personal care within our services. So when the time came that we were able to relieve staff of wearing masks, predominantly, etc., and some of the rules were laxed within our accommodation, we followed that for daycare. We then were given an inspection from our care inspectorate, and she was very clear that we are a registered care service and we should be following care home guidance, which was very different to daycare services.
Well, I'll come on to that and I'll get some more. But if I can go back to your statement, Mr. Smith, and paragraphs 82 and 83, where you talk about precisely that.
Yeah.
Tell us about that.
Yeah, so we were, I mean, we obviously have contact and information that was coming through our contractor, the Health and Social Care Partnership, and that was coming through NHS Tayside Public Health. We were also getting advice from Fair Share UK, who are the national kind of charity that governs Fair Share, and kind of we were looking at all this information kind of coming down. So with regards to that, we followed public. I mean, we were contacting Public Health, and we had to do notifications, etc., and and feeding back to the through our contractual mechanisms and monitoring mechanisms through the Health and Social Care Partnership, and that was, I mean, and they were aware of what we were following, what we weren't following. We were taking, if we had any queries, we were phoning up the Tayside Public Health team, and they were saying, well, you do this and you do that, or you don't do this and that, etc. And that was all going well, and we felt it was appropriate given the kind of support we were giving to individuals. And yeah, we increased things like cleaning. We had, I mean, for example, we got hand wash dispensers from Marks and Spencer's, which were kind of dotted all around, and they were big industrial ones, which means there was always opportunities for people to kind of keep their hands going. We had posters up, we had kind of 2-metre markings, etc.
In your statement at paragraph 84, you refer to the matter that Ms McLaren just referred to.
Yes.
Could you just read paragraph 84
yes,
for us?
We received our annual inspection from the care inspection. As the pandemic, we were coming out the other side of the pandemic. The inspectorate dates were the 11th of August and then followed up on the 25th. At the beginning of the inspection, I was asked why I was not wearing a mask, to which I replied we were not required to wear masks in line with the public health guidance. However, she informed me that we were classified as a care home and should be following care home guidance, even though public health had told us we shouldn't. As a result of this, our marks for inspection were put down to a 2 on a scale that goes up to 6. So we were classed as inadequate, and despite appealing this mark, it was argued that because we were following public health advice, we were told we should have been following care inspectorate advice.
Paragraph 89.
Yeah.
You see there, that was frustrating.
Yes.
Tell us about that.
It was frustrating because the amount of work that the staff had done during the pandemic, and the care they had taken to follow ultimately the wrong guidance had been shown in a two. And you mean whilst I appreciate you mean when a care inspector report comes out, one should read it and look at the context and everything, but ultimately it all boils down to a number, and that number was 2, and the staff seen that and felt kind of devalued and demoralised that kind of all the hard work they had put in had been kind of thought they were doing the wrong thing. And I think it was, I mean, as a management team and as a chief executive, for us it was kind of, you mean, I felt, well, you mean, why were we then left in this position where we weren't sure what guidance to follow at that point?
Can you tell us about paragraph 89 in your witness statement, please?
Yeah, it was. Do you mean we didn't? There was guidance coming out kind of regularly from Public Health, and there was guidance coming out from the Health and Social Care Partnership, and there was guidance coming out from the care inspectorate. But we've always found with lots of things that housing support and homeless housing support always kind of falls between two stools. And you mean, and at no point were we told you're a care home, and at no point were we. I mean, so we looked at what was most appropriate for us, and Public Health agreed. So there was no specific guidance came out for hostel accommodation that we.
And 85.
Yes, it was near the end. If I remember, it was about the 8th or 9th reiteration of the guidance that homeless accommodation was finally in the guidance as almost a footnote. And whether it was because of our protestations or because of others' protestations, it was. I mean, up to that point, we were kind of looking at what we were doing in line with what the regulations were saying, and kind of pitching ourselves in the kind of support we were given.
You said this was the 8th or 9th iteration
yes.
of the guidance that had been provided. Presumably you and your colleagues in the management team had to go through the previous 7 or 8.
Mm-hmm. Yes.
But there was nothing in there directly for you at all? No.
Not that we could see, and taking advice from kind of colleagues and kind of others in the sector in our area.
87, you say something about that?
Yeah, sometimes it was potentially too much information. I mean, and contradict you. And I think the example we've given of the difference view from Public Health and the Care Inspectorate. I mean, the information was basically the same, but there was no one who can say, well, that's the information that's required for you. And I think, I mean, it should be said, when we talk about lack of clarity, if I remember correctly, on the 11th, the first day the inspector came and said, this is where this is the situation, and you should be wearing masks. I then phoned Public Health later that day, and they says, no, we think you're right. It wasn't about 3 days later that the Care Inspectorate, following kind of lots of discussions, came back and says, no, we've agreed that you're wrong.
With whom?
The Care Inspectorate.
Have agreed with whom?
Have agreed with others in the Care Inspectorate.
You've mentioned earlier your good working relationship with Dundee City Council, yes, and also the police.
Yep.
You haven't mentioned your working relationship with other third sector organisations very much, mm-hmm, but you do say something about that at paragraph 88.
Yes. So basically, I think we were somewhat unlucky. We were we were one of the first organisations inspected post-pandemic. So after we'd been given these lower scores, we basically got the word out to other organisations in our local area and said, if they're coming to inspect you, be aware they're looking to hold you to these standards, not the standards, because we know for a fact that they were following the same processes that we were. They subsequently beefed up their standards and were given higher scores accordingly.
Okay. Now, one of the things which you also refer to is that scoring mechanism can impact on future funding.
Yes.
Tell us about that, and tell us about your relationship with the health partnership and the council.
Well, I would say, I think in general, I would agree that, getting a score of an inadequate or a 2 could potentially would lead a commissioner to say, why are we commissioning a service which is seen as inadequate? So those discussions weren't had because they were confident that we were following kind of the public health advice and took it as that's a disagreement. It's unfortunate, but it's one of these things, and we know that you were following advice because we were part of supporting you in getting that advice.
Okay. Could you read paragraph 94 aloud, please?
Yep. There was a disconnect between the Care Inspectorate and Public Health Scotland, or Tayside Health. I think there was just so much similar but different information coming through at that time.
And in essence, it would appear from paragraph 96 that your funders just overlooked the 2 out of 6.
Yeah, and basically says, we know you. You were following public health. We would have expected you to follow that, and yeah.
So is that another example of practicality kicking in?
Yes. They were aware of what we were doing, and comfortable with what we were doing. We had a forum that kind of at the start of the pandemic was meeting 3 times a week, if I remember right, where all the third sector statutory agencies were getting together and looking at kind of what we were doing, and we were all following the same, and it was about monitoring kind of infection rates and monitoring kind of work, etc., what procedures, what access to PPE, etc. So that was all going on. So they were well aware of what we were doing right along the pandemic, and we're happy with it. And any advice we were seeking from the Health and Social Care Partnership, they would say, go and speak to Public Health Scotland or NHS Tayside.
But not the Care Inspectorate?
Not the Care Inspectorate.
Okay. We haven't heard from the frontline worker on that. Can I go to your statement, Ms McLaren, at paragraph 51? So you're getting guidance in, and you're talking there about tailoring it to suit your needs. Tell me about that.
The guidance was guidance for the amount of time that you were supposed to spend with someone. I'm not sure if the 15 minutes is correct, I can't remember fully, but I think sometimes we have to use common sense. And if our staff are saying that the people who we are supporting are in crisis and need longer than 15 minutes, and sometimes that could be the difference between someone going home and having to call NHS because they're then in crisis with their mental health, and either that could escalate to whatever, who knows, then I think we need to do that, and that is what we've done. We took advice from our staff. Our staff were very careful, making sure they had full appropriate PPE on, and if the person was able to, the person would also wear full PPE. I just think we had to use some common sense. through the guidance. Also, some of, like I said before, some of the guidance just didn't make sense. And with regards to some of the guidance that was in for the care home that we were then instructed that we should have been following, we would never have been able to, because some of that included the disposal of PPE, and if somebody was suspected to having COVID, the guidance within the care homes is it gets wrapped into a specific colour of bodily fluid bag. I'm guessing it would be red, and that would be put into a yellow bin. We don't have those facilities because we're a homeless hostel, we're not a care home.
Can I take you to paragraph 69 and just ask you to read that, please?
The guidelines were not written for housing support organisations such as ours. We did not really fit into the guidance being provided. We were following guidance. I can't recall the specific one, but it was not the one for care homes.
Mr. Smith, can you go back to 96 in your statement? Mm-hmm. I'm not going to ask you to read it aloud. I'm just going to ask you to tell us about it.
Because we were following the guidance, and we were seeing people face to face. So people were coming down to the office. If people had issues with their flats, so we'd have to maybe go up and support them in their flats. But we were doing everything kind of within kind of guidance for the general public. So it was 2 meters, it was masks, sanitising, washing hands. If there was concerns, there was glass. We had masks, we had, eye protection, visors. We had access to more PPE if we needed it. And if we were doing, if we're doing extra cleaning, we had gloves everywhere. We had aprons everywhere, masks everywhere. We had sanitizer in every room, and kind of every time somebody interacted, we wiped down tables. So we were probably doing more than the general pub. We were following that kind of that guidance, but we were doing more than anybody. The normal general public were doing.
And the next section is relating to PPE.
Yep.
And you indicate there something that we've heard from elsewhere, that initially there were problems accessing PPE, but once a local portal was opened up in Dundee, those problems effectively disappeared.
Yes, it was, and when we talk about the problems, we're only talking about kind of probably a couple of weeks until things kind of kicked into place.
At paragraph 102, you talk about something we haven't heard about elsewhere, which is bombs.
Yes.
Tell me about your bombs.
Yeah, we located them through a cleaning company who came to us. We had a relationship with them, like a chemical supply company, and these had these bombs similar to bug bombs, where you would place them in the room, they would explode in some way, because we weren't allowed in the room as they exploded, so we're not quite sure what happened. But they exploded and sanitized the room within 4 hours, and they were registered or licensed to do that. And that allowed us, when people did leave, that we could turn rooms round within the same day. They were quite expensive, but if you're looking at it in a pure financial, it was much cheaper buying the bombs and than having a room sit empty for 72 hours. It also helped kind of getting some movement back into the system. They were they were excellent. They were the only company we could ever find who done them.
Did they discount it for you? Did they discount the price?
No.
No, you paid full price.
We paid full price for them, yeah.
But it it covered its own cost.
Yes, and I think there was discount just because the amount we were buying, but not a special discount. We got bulk buying.
You then move on to legislation, and I don't need to ask you anything about that. But you then move on to funding, and 110 say funding for housing support didn't change, but funding for food did change. And I think what we can take from your evidence earlier is that your housing costs, if I can put it that way, didn't change, but your food costs did.
Yes.
So your funding mirrored that.
Yes. So do you mean there was more food coming out in, but there was obviously more food going out? So do you mean we whilst it was kind of pretty in that sense, it was all about turnover. So it was just more coming in, but there was more outgoings as well on that. So do you mean there was no great difference in kind of the sense of bottom line, but do you mean just the volume was there?
Paragraph 117, you talk about additional funding.
Yeah, there was you mean we were given extra funding? There was some extra funding come through Fair Share UK, and some of that was for logistics, and that was kind of the central element of Fair Share UK, kind of looking at how we get food around the country. And there was also stuff from local authorities, as I previously said. Perth and Kinross rented a warehouse kind of at the confluence of where the Glasgow and Edinburgh roads meet, which was ideal, which was able to kind of have warehousing there. You mean there was potentially extra money there to there was potentially extra money for extra vans, etc., if need be. But a lot of the money, especially from the Scottish Government and from kind of the national government through Fair Share UK, was given very much directly for specific things. Do you mean? And so some of those things were directly given, were directly to us, and some things were us having exclusive or part use of.
And in relation to funding at paragraph 118, you talk about the process by which you could access it.
Yeah, there was, do you mean, I say I wasn't as directly involved at that point, because that's at the point I was just taking over. But yeah, there was the Chief Executive's office in Dundee had an overview of what was happening in the city, and they were linking with Scottish and national government to look at what funds, etc., were available both for access to local organisations or the local authority or could access, and therefore kind of support the development of services within Dundee.
119 and 120, you say that things were more proactive and less bureaucratic.
Yes. Yeah, that was very much. In that paragraph I talk about funding, but that's often. We found that in a lot of things. But yeah, there would be times where we'd get calls from, say, Dundee City Council or from Fair Share UK, say we've got some money to do this specific piece of work or to get this amount of food out. We'll send the money and we'll get we need this form filled in, but get that form done when you can get that done, because the important thing is to get the money out there and get it helping people. Some of that stopped the minute the last lockdown or kind of restrictions finished.
Has any of that carried on?
In some areas, and Ms. McLaren kind of said earlier on about, I can't remember the exact example, but there was an example. It was about the drug diaries. So some of those processes have carried on, but
funders' supervision.
No, they've gone back to
square one.
To square one generally. I think there's maybe been some changes in how some of the lessons learned have been. So some of the monitoring is different, not necessarily looser, but different.
You next talk about no access to public funds, people,
yes.
And that doesn't really impact on your organisation.
No.
But you then move on to service users without allocated accommodation. Can I take you to 128? 127 talks about the bus that went round town, which was a support mechanism for drug users. But you then, at 128, say something additional.
Yeah, I think you mean the bus. The bus was a great help during that period, and you mean, and I think that has been the way the bus has worked has really been a driver for kind of changing those access to statutory services in Dundee, and now we have the Hope Centre in Dundee, which has basically has derived from the bus, which is now 24-hour support for people who are in crisis. Our team advocates for the service users, and you mean whether, and you mean so we will get people turning up, people's friends, people's family who are in crisis, and we kind of will advocate for them. And I say the bus was a great way of doing that.
And that was a start, and then it moved on.
It's moved into a dedicated building in Dundee, and I say, thank God, because the bus was probably out its MOT by now, but it wasn't the best bus, but it did do a job. And the great thing during the pandemic, it was able to go around the city and go to specific places where we knew the people were, and so people weren't having to come into the town centre. So we're going into Lockheed, to Hilltown, into Whitfield, and doing those.
The part of paragraph 128 that I was seeking to draw your attention to that I don't think you picked up on was there were issues surrounding access to statutory services, which was problematic. And then you talk about your advocacy skills. Are there still problems in Dundee accessing statutory services?
Yes, I would say. You mean it depends on the team, and I think a lot. You mean it depends on what services we're looking to access. But you mean that there can be issues accessing people. I would say particularly mental health services. It can be problematic for people. You mean there has been kind of some real good changes in accessing drug and alcohol services, but mental health services are problematic.
And were those exacerbated during COVID?
Yes, I would say they certainly were exacerbated through COVID. Mental health services have been a problem in Dundee for quite a while, which is kind of highlighted in other reports, etc.
The next thing that you talk about are delays in temporary accommodation. I think we've covered all of that. It's about essentially hotels. Paragraph 136, you talk about something about yourself. Could you read that aloud?
Because I am the CEO, if I was going into places then infection control measures were well maintained and everyone was doing it. However, in the middle of the night when people are wondering about, it was perhaps not as tight.
Is that a reflection of the old phrase that the Queen thinks the world smells of fresh paint?
Yes, I would agree. I think kind of there was a, and I think kind of we can all probably agree that kind of as the pandemic went on, there was a weariness for it, and people would think, and Ms. McLaren brought up earlier about kind of people sitting at a table without a mask and then wearing a mask if they're standing up, but if somebody's standing up only to go, to grab a biscuit or something, I don't need to put a mask on to do that. And I think, that was, yes, I would agree. And that still exists in any organisation. I'm not, I know that people might not always be following everything at all times, but you have to be pragmatic about that. But yeah, it was a potential. I knew that was probably happening.
At 141, you talk about the different attitude during the pandemic.
Yeah, and I think that was one of the really interesting things about the pandemic, in the sense it was almost a Dunkirk spirit to it, in the sense that we would have these meetings and everybody was volunteering to do stuff and kind of go out with their contracted services, and we can do that and we can meet them there and there was just a completely different attitude, and it was like the reins had come off. As a third sector organisation, what I love about it is if someone comes to me with an idea, we can say, oh yeah, we'll try that and we can start that on Monday. Sometimes in the statutory services, that can take months. It has to go to committee and come back, and it's diluted and what have you. And I think there was much more of that. How do we fix this? And kind of a much more kind of solution focused thinking by everyone in the public and third sector.
142, please. You just tell us what you're saying there.
Yeah, I think a lot of that has gone back up. People who were working in silos have gone back to their silos. I think a lot of that. We can fix things. We can between us get a solution for this has gone back up, and there is kind of a lot of the bureaucracy has fed back in, despite, I would say, during the pandemic, people would say this is great. We're getting things done. It's really kind of positive, collaborative, and I think kind of in some areas that's drifted back.
Ms McLaren, your statement at paragraph 32, you talk about a similar thing. Can you just tell us what's there and what you have to say about it?
Just the same as what Mr. Smith was saying, I've described it as the red tape was cut. I think before the pandemic, our staff, and certainly when I was frontline staff, you felt that the statutory services were superior. You were never given any information. If you requested information from statutory services, even though as the third sector organisation, you would be the one working with this person the closest, you'd be providing the most support on the ground. That changed during the pandemic. We were seen as proper key partners alongside our statutory services, sometimes more than that, especially when statutory services weren't leaving their homes. So we were really relied on, and staff felt really, really valued during that time. And as Mr. Smith has said, some organisations that has gone back. Very glad to say that not all organisations. We still do have some great working relationships with some of the organisations in the city.
At 144 in your statement, Mr. Smith, there's talk about addiction support. And we've heard quite a lot about that today, but you say something quite interesting at 146.
Yeah, I think one thing that happened over the pandemic was we did see a real change in the drugs that people were using. We'd traditionally kind of been a lot of opiates, a lot of heroin in Dundee, and we've seen kind of a real shift. Now, whether that would have happened in spite of the pandemic, it'll be difficult to say, but we have seen kind of a real increase in cocaine, in crack cocaine, in synthetic benzodiazepines, and things which are really, we're not 100% clear what exactly they are and what the outcome, what the outcomes for individuals could be. I think the difficulty, and this is kind of, there's still kind of an opiate-based recovery services in Dundee. I know they're trying to change, but as we spoke earlier, some of the statutory services, it takes them much longer to change than some third sector organisations, because we are seeing a marked decrease in Dundee of opiate use and kind of a real increase in stimulant use.
And at 147, you the information you have regarding overall drug usage.
Yeah, as say, you mean treatment? You mean we said earlier on that we are kind of advocating for the service users, and it can be difficult accessing because you mean we are we would be advocating for this and supporting the service user in accessing drug services, and that wasn't always possible due to restrictions, and that was used a lot of times. That can't happen because of the COVID restrictions. That can't happen because of the COVID restriction, and not being person-centred on. The pressing issue here is someone's addiction, and how can we work with that?
You say the next thing that you address is alcoholism, and that speaks for itself. We don't need to go there. Okay. But in terms of homelessness and addiction support, you say something of no at 154. Could you just read 154?
Yeah, around 80% of homeless individuals that we support have some kind of addiction need, and this has and did remain fairly static throughout the pandemic. I would say that most people who come into our homeless services are kind of chaotic and have either a drug or alcohol or severe and enduring mental health issue. And you could argue all day kind of why and what came first, etc. But I think that if you're homeless and coming into your services and all you need is a new accommodation, that can be that's fairly easy to not easy to resolve. That's I need a house and we can support you to get a house, but it's maintaining the house. It's the other issues that are preventing people from maintaining that house, which are an issue. And I would say that number of 80% is still around where we are.
Okay. You talk about the impact on you as Chief Executive Officer, and again, at 159, you talk about your team being strong and good.
I would say they're a fantastic team, and it's we talked about that can-do attitude, and a lot of that came from the team saying, no, that's something we want to do. We are here to work with kind of some of the most complex people in Dundee, and it's important that we do that and give people who need that support the support they need.
In light of the lessons that your organisation considers it's learned, you say something about developing policy. Can I ask you to read 165?
We found that a lot of organisations were very keen to engage with developing policy, especially within the third sector. For example, the Health and Social Care Partnership were very engaged, and there were individuals within that who were super engaged. The Scottish Government were also well engaged, but found that the more arm's length organisations such as the Scottish Social Services Council and the Care Inspectorate were not as helpful as they could have been.
You then say the lessons to be learned is about communication and consistency.
Yes. I think it is about kind of everybody being aware of what their role is. Do you mean and who is taking those roles? I think there was too much insularity by some organisations, kind of national organisations, who were looking at their own kind of what they were doing and didn't see what was like on the ground, and how you mean and we at the heart of what we were doing were service users who were struggling and requiring support, and it was important that kind of their voice was heard in all of this. And I think kind of that communication from service users, and maybe we're at fault of that as well, wasn't getting up to those organisations, kind of tell them what service users were at the heart of it.
Mr. Smith, I've tried to ask you all the questions that I think are relevant Is there anything useful and necessary that you think you can add at this stage?
No, I'm quite satisfied with what I've said to this point, other than kind of again thank the organisation and the staff team for the service they provided and during the pandemic, because it was a remarkable job.
Ms McLaren, I have the same question for you. Is there anything that you consider you can usefully add that we haven't heard yet?
No, no thank you.
And can I thank you both for your attendance today and your evidence on behalf of the inquiry.
Thank you.
Indeed, thank you both. 1:30 for the next session.
I think that's correct, my lord.